For selective demonstration of the apical posterior segments of the left upper lobe, we use this special catheter. After passing the bifurcation, it traverses the left main bronchus and enters the upper lobe bronchus. The tip next enters the opening of the posterior bronchus and occludes it in its proximal part. The contrast medium is then injected, and this segment alone is then displayed. Finally, this catheter is suitable for displaying the apical branch of the right lower lobe bronchus, which can also be filled separately. Naturally, other bronchial segments can also be demonstrated in a similar fashion. The catheter is withdrawn into the main bronchus. The contrast medium then flows into the middle lobe and lower lobe bronchi. Before these procedures are undertaken, premedication is used in order to reduce bronchial secretions, and a barbiturate is given to reduce the toxicity to the mucous membrane of the anesthetic agent. In addition, it is advisable to give a subcutaneous injection of dromeran roche with the antagonist lorphan, mixed in the same syringe, half an hour before bronchography is carried out. By these means, it is easier than it has been hitherto to reduce the tendency to coughing during the examination. Lorphan is used to prevent the respiratory depression which occurs when using a morphine-like compound alone. Good local anesthesia of the air passages is necessary for carrying out bronchography. A local anesthetic is first applied to the base of the tongue, the posterior wall of the pharynx, and the larynx. Then, with the aid of a laryngeal mirror, the trachea and bifurcation are anesthetized. One side of the nasal cavity is then anesthetized for the passage of a catheter. After these preliminary measures, the examination proper begins. The catheter is introduced into the nose. Then, by means of cineradiography, its further progress is observed. After it has passed through the posterior nasal aperture, it slides over the posterior nasopharyngeal wall into the laryngopharynx. It then passes behind the epiglottis and pauses just above the vocal cords. It passes between these and into the upper part of the trachea. At this juncture, the patient is turned to face the examiner. The descent of the tip of the catheter as far as the bifurcation can easily be observed in the trachea. On the left side, close to the trachea, the pulsation of the aorta can be observed. The guiding sound is now removed. The terminal portion of the catheter then regains its original curve and passes into the left main bronchus and the upper lobe bronchus. After renewing the anesthesia, the water-soluble contrast medium is slowly injected. It first fills the anterior branch, it then flows upwards into the posterior bronchus of the upper lobe. This and its various branches can usually be recognized as far as the periphery. The lingular bronchus arising from the upper lobe bronchus can also be seen running in an inferolateral direction. The contrast medium has filled the upper lobe bronchus, the main bronchus, and the lower lobe bronchus. All these bronchi can be seen clearly as far as the periphery. Slow rotation of the patient gives a stereoscopic impression in a normal bronchial tree. These X-ray pictures, which can also be used for observing the course of the examination, were taken by using an image converter. This can be mounted on a screening apparatus. Inside a protective case is the image intensifier tube. In the interior of a vacuum glass container is an X-ray fluorescence screen mounted on a thin aluminium frame. In contact with the X-ray screen is a photocathode, opposite which is an anode connected with the observation screen. The X-rays penetrate the patient and produce on the fluorescence screen an electronic image. If a high voltage electric current is passed between anode and cathode, the electrons are speeded up in the direction of the observation screen. As a result of electrostatic projection onto this screen, an image is seen, the light density of which is increased 800 to 1,000-fold. This bright, reduced picture is observed through a telescope. Instead of using this optical apparatus, single-stow photographs or cinefilms can be taken.